Hi, my name is Dr. Danielle Walker. I'm a certified health education specialist and I'm also a certified contact tracer. And today I'm just going to answer a couple questions that have come in around what is public health and what is contact tracing, just to kind of give you a background and understanding as you're hearing a lot of things in the news. And so first of all, public health is a field dedicated to promoting and protecting the health of a community. So it's a little different than kind of an MD or more traditional doctor of one-on-one care, where it's looking at a population as a whole and how to protect and promote the health of a population. And this includes research, statistical analysis, behavior change, policies, and responding to emergency outbreaks. So, I've worked in a lot of different areas in public health. I've worked at the CDC, I've worked at state health departments, city health offices, and also at the university level. And so I just wanted to give you a little background and insight into a public health professional and those that I've worked with, because I feel like it's a little misunderstood. And public health professionals, every single one that I've met has such a heart of compassion, and they're so selfless, and I just feel like they're being misrepresented right now. And we don't get into public health because we want to control people or come up with crazy control policies, but we get in public health because we want to protect and promote the health of a community, and because we really want communities to thrive and want what's best for people. So we're not secret people sitting in our offices coming up with crazy ideas, but we are working hard to try to protect the general population. And we're just regular people. We want Disneyland to open. We want restaurants to open. We want to get back to our regular lives, but we want to be able to do that in a safe way. When we talk about contact tracing, this is actually nothing new. It might be a new term for a lot of you because we don't live in a country where we actually have to do a lot of contact tracing. We use contact tracing regularly with tuberculosis, with Ebola, with measles, with STDs, with HIV. So if you haven't had any of those, you probably haven't come in contact with a contact tracer. But contact tracing has kind of become a buzzword with COVID-19 and this new outbreak because it is one of our primary ways to contain a disease. And so when we look at disease outbreaks and containment, there are two options that we have, and we have a vaccine or contact tracing. And right now, and usually early on in disease outbreaks, there aren't vaccines for an option, and so we really have to focus on contact tracing. And so I want to explain what that is, and it's not as scary as it sounds, and I want to walk you through what it's like if somebody was to call you as a contact tracer and ask you questions. So if you were to test positive for COVID-19, a contact tracer would call you. And this could be a public health professional like myself, it could be a doctor, it could be a nurse, or a health department worker. And all that happens is they call you, they inform you of your diagnosis, and then they just ask you simple questions to walk through a timeline from when you were potentially exposed to when you started to develop symptoms to that day. And what that does is it gives a window of when you were likely contagious. And then they just ask you questions around what you did and try to identify who you came in close contact with during that contagious window so that they can go ahead and follow up with those people. When they go ahead and follow up with those people, it's a completely anonymous process. They don't call them and say, hey, your friend got diagnosed with COVID-19. They call them and they say, you were exposed to somebody who tested positive for COVID-19. We want to let you know, we want to tell you where testing facilities are, and we suggest that you quarantine for 14 days to watch for symptoms. And what that does is that stops the disease progress. So that stops somebody from going out and passing it on to somebody else and somebody else. It gives us that window to stop and break the chain of disease. The contact tracer also will talk to the person who's infected and make sure they're okay. They'll walk through symptoms with them. They'll tell them where they can get care from a doctor. They'll tell them what to watch for. And it's really more a support system, and they're not collecting your personal information. They're not collecting data from your phone. They're not going through your social media accounts. We don't want all that information. It's just to make sure you are okay when you test positive and to follow up with those who maybe could have come in contact with you.